Hello, everyone. My name is Dr. Raina Pettitt, and I am the Chair of Primary Care here at Meredith School of Osteopathic Medicine. I am so happy that you have chosen to interview with us today. I've been asked to give you a short presentation about the Clinical Skills course. So what is this course? You'll often hear this called the CS course or the Clinical Skills course. This is 4 courses over the first 2 years of your medical education. This course teaches the history and the physical examination skills that you need to practice medicine. This course will also teach you how to document a note in a patient's chart. We will use standardized patients, which are patients that have been highly trained, so you can interview them and perform the skills that you have learned in this course. We also use simulation, which is our mannequins, to help you facilitate your learning in this course as well. Students often refer to this course as the How to Be a Doctor course. So in this course, you will need certain medical equipment. I do encourage you to wait on buying this equipment until you come on campus, and we will provide you with the required list. This is also the course that you get to wear your white coat. Your white coat is used for all of your standardized patient encounters, your oral case presentations, and you'll also get to use that coat on your rotations in your 3rd and 4th year. So when do you have this course? Every Wednesday, you'll have a lecture either at 10 a.m. or 11 a.m. And then on Wednesday afternoon, you'll either be broken down in groups that will have lab from 1 to 3 or 3 to 5. You'll often hear me call Wednesday, CS Wednesday, one of my favorite days of the week. So to optimize your learning, there's a certain dress code that all students need to adhere to. During lecture, you can wear your normal classroom attire. But during labs, it depends on the lab that we're having. You may be able to wear your normal classroom attire, or you may have to wear shorts, t-shirt, and a sports bra. It all depends on what we're learning that week, and I will send you a correspondence with that information each week. Proper dress code is required to participate in lab. So why do we have different dress codes? The examination requires exposure of different areas of the body so that your partner can learn and practice the skills. So the style of lab will change with the material that we're learning. I have different small group labs, and that's more of a discussion type of lab, or I have larger group labs for which we'll learn different examination techniques. We'll use task trainers. I also have different schedules for you that are staggered labs or labs that have different stations. No 2 labs ever look alike. I'm always changing them. Since you are unable to come on campus, the next few slides will show you where you'll be having these labs. So this particular part of the building can partition off in different sections. So this is where we're going to have our small group labs. And this is where you'll have your larger group labs. Look toward the far middle. What you'll see is a stage area, so techniques will be demonstrated from the front, and you'll be paired off at tables to practice these techniques. So let's talk about those standardized patient encounters that I mentioned earlier. These are also known as OSCEs, which is Objective Structured Clinical Examinations. This is one of my favorite parts of this course. You'll see patients in an examination room as a student doctor. You'll get to implement all that you've learned in lab with live patients. There is a special dress code for OSCEs as well, which I'll talk about when you get on campus. But if you're still unsure as to what this is, don't worry, I have an entire lab devoted to what this really means. Here's what one of those examination rooms look like. It looks really close to what you're used to when you see a doctor. Here's another example of one of our examination rooms. But don't be nervous about this part of the course. I'll make sure you're ready to go. Simulation is another part of this course. This is introduced early in the first semester. I use what's called high fidelity mannequins, and you're going to be blown away by what I have in store for you. I also use task trainers, which are smaller type of mannequins that help you learn different procedures in different parts of the examination. The next few slides will highlight a few of our mannequins that we have for simulation. This is Hal, and you'll get to know him throughout your time here at MSOM. Now, I can do many things with simulation. Look at Hal's left eye. See how it doesn't look like the right side? It's a little closed more than the other side. So take a look at this video. Again, don't be nervous. I will make sure that you are ready to go for all of the things that Hal can do in simulation. And this is Victoria, and she will help with your obstetrics simulation. So in the simulation lab, you'll learn how to deliver a baby as well as the newborn care right after a delivery. So this course will teach you how to talk to all patients, including our pediatric patients. I've got simulation to help assist you with this as well. Sometimes our patients need to be in the hospital, and sometimes our patients are outpatient in the clinic, and we'll teach you how to address both of those different types of settings. So everyone can get a little nervous when their blood is being drawn, especially our pediatric patients. You'll see here that he's crying. You'll see here that he's sweating. And you'll also see here that he's sweating down here as well. And we'll help you deal with that with all of your patients as well. So welcome to Meredith School of Osteopathic Medicine. And I look forward to teaching you the skills needed to become a compassionate, skilled physician. Enjoy the rest of your day.